I was in a car accident in 2017, and I started getting headaches, about 6 to 8 headaches a month. I was seeing a neurologist for those headaches. The neurologist at that time just said, oh, here's some medication. So I was getting progressively worse. It was affecting my quality of life, and I felt as if I was just going downhill. So I received a phone call at 8 o'clock in the morning on Monday morning from the neurologist. And he said, very coldly, I might add, you have a brain tumor, you need surgery. Call this neurosurgeon and try to get it. I couldn't go home because I felt like I wasn't sure what it meant. And I felt like I couldn't face my kids.
I'm a neurotologist with a very unique practice here at UC San Diego. My whole career clinically is devoted to the care of acoustic neuroma patients.
So I did talk to Dr. Friedman. He FaceTimed me while he was surfing at the beach. And in my heart, I knew that UCSD was the right decision, knowing how many patients that they do surgery on and how successful their program is in comparison to other programs.
Dr. Schwartz and I have been working together since 2002, and we do somewhere between 160 and closer to 200 cases per year. I can't emphasize enough that experience is absolutely critical to success.
Every single nurse and tech within the neuro ICU was completely familiar with the recovery process after my surgery. And whenever I would ask, is this normal? They would say, oh yeah, this is perfectly normal. I would say the first 10 days were just extremely hard. So difficult and challenging. Once I got on that plane home, it was just great. My recovery just went uphill from there.
The main objectives I would say we have in surgery is tumor removal, making the visit here the last treatment that an individual needs for their acoustic neuroma. And then the absolute first priority is protection of the facial nerve.
When I spoke with Dr. Friedman and Schwartz about coming here, one of the first topics of conversation was facial nerve preservation and what their approach would be to preserving my facial nerve. And their approach is the reason why I chose UCSD. And I just had a feeling that my facial nerve would be preserved if I were to come to this hospital. And that's like, look at my smile.
We do somewhere between 160 and closer to 200 cases per year. I think people select us because of the surgical reputation. If you surveyed our patients, they would absolutely say that they're better off for having come here and better off for the care they received here.
My quality of life is so great. It was a long road to get here, and I am just so thankful that I'm here now and I'm able to share my story and help other people and hopefully get everybody I can to UCSD. I want to remind other people, yes, it's really scary, but it's gonna be okay. And this is gonna suck, but you're gonna get through it. And whatever you think the hurdle is, you're gonna overcome it and you're gonna be back to normal. It's just gonna take a little while to get there.